So welcome everyone to the Connected Kinesiologists meetup for Monday, April the 12th. Thanks so much for being here this evening. We're going to go through some introductions and then introduce Matt Faria from Sun Life Financial this evening. I'm Angela Pereira of First Line Education. We're a company that upskills kinesiologists, helping them to bridge the gap between university, college, and the workforce. So I'm going to pass this over, let's say, to Tori to say hello and let us know what you're up to.
Hi, everyone. My name is Victoria Galetta. I also go by Tori. I am in Collingwood, Ontario, and I own my own kinesiology business called Pure Movement, and I focus mainly on aquatherapy, and then transitioning into like land-based from the water. So yeah.
You're losing your fins, or you've got a combination of fins and legs at the same time?
I'm actually in the pool a lot right now just because we're in lockdown and the pool decided to open for me. So I've been in there like 5 or 6 hours a day, which
wow. So you're pretty wrinkled and warming up now as you get out from the end of the day.
Yeah. It's been great though.
Mackenzie, hello. You want to say hi and introduce yourself? Oh, nope, she went off camera. That probably means no thank you at the moment. Oh no, you're back.
Yeah, sorry, a little technical difficulty there.
Not a
I don't
problem.
know what happened, but yeah, I'm Mackenzie Regneris. I'm a newly registered kin as of January. I recently landed a job as a, cutting out again apparently. Recently landed a job as a kin in Brantford, Ontario, working with more chronic conditions in the adult population. And yeah, a lot of kind of Parkinson's, acquired brain injuries, just frailty in general. So that's been a really good experience so far and hoping to do good things with that.
Nice. Congrats on the new job. That's great.
Thank you.
Carrie, hello.
Hello. Yes, so my name's Carrie. I'm located in Kitchener-Waterloo, Ontario. I too have my own business called Carriedale Kinesiology. I provide in-home services to those who have neurological things going on, mostly stroke at this point, and also seniors. I also do fascial stretch therapy, and it's all based out of my clients' homes. I don't have a clinic or anything like that.
Nice. Christiane, have you moved? Are you still? Yes,
Yes, I have.
Congrats.
I am way up north.
Yeah.
So I am actually in Geraldton, Ontario, working in a hospital / LTC. Went from full LTC to hospital and LTC. So it's kind of interesting to learn the different systems and learning different styles of documentation. Today was my first day, so I've definitely got a lot to learn.
Congratulations. That's really exciting.
Thank you.
That's a long flight up there, or a couple of
flights. Yeah, because it's basically I flew to Thunder Bay and then I took a bus, so that was a long bus ride.
Oh wow. Deanna, hello.
Hi, I'm Deanna. I am a mobile kinesiologist in Huntsville, Ontario, and do a wide variety of contracts and odds and ends, as well as see my own clients. So it's fun up here.
Awesome. Yeah, so you have a wide range of clients, from cancer rehab. Was that the majority, you would say?
No, there's a cancer class I teach, and then there's persistent pain and some like the GLAD program and an osteoporosis program. And,
right.
And then some clients in retirement homes, which is fun too.
Lots of different autoimmune.
Wide variety in small town.
Yep. Ryan, hello. I haven't seen you in ages and ages. How are you?
Good. How are you?
Good, thank you.
So myself and my wife own a clinic in Oakville called Live Well Exercise Clinic. It's a franchise system, mainly based out in Vancouver area, but they have a clinic. Well, we have the clinic in Oakville, and then there's one in Bowmanville as well. So it deals mainly with people with chronic disease issues. And then I also run the corporate wellness program for DeFasco in Hamilton.
So you're still doing that. That's where we met years ago.
Yeah, 10 years, almost 11 now.
Nice, nice, nice. That's great. And that was impressive. I was blown away by the size of DeFasco and all the things that you guys were doing there. So yeah, wow. That's great to know that that's still going strong. It's fantastic.
Yep.
Nice. Who am I missing? Emma Donnelly, are you there?
Hi.
Hi.
Yeah. I'm Emma Donnelly. I am a student waiting to write my exam in whenever they have it back. And I'm in Toronto, Ontario.
Awesome. Excellent. Yes, we're all feeling for you guys. The college canceled the April exam and we don't have a date for the new one yet. And we're told it's coming before the next writing, which is in September. So there's a lot of people who were crazily studying and now their exam writing is up in the air a little bit. Zana, how are you? Zana may not be close to her computer. Her mic is not working. Oh, sorry about that. Whereabouts are you in the country? And what kind of kin work do you do? As she types into the chat here. And I'll let you type and I'll move on. We'll pop back. So France, hello.
Hi, good evening, everyone. I'll put my face on just a second here.
Yeah, sure.
Oops. If I can, if it won't let me. Hi, nice to meet you, everyone. Of course, I'm the CK Executive Director. I don't often attend these because there's so many of them, but it was a pleasure when I heard of Matthew coming up. Now that CK has came to an agreement with them, with this team, in order to help you kinesiologists to network. And because this year the CK is doing, I'd say, the most ever done in trying in insurance initiative in order to promote kinesiology within the health benefit programs everywhere. So, and I'm here to listen to you guys and hear how you're living it and to get more ideas on how we could help you.
Wonderful.
Nice to
Thanks
meet
for joining us. That's just great. Zana just chimed into the chat. I'm a kinesiologist in Windsor working in a WSIB specialty clinic. She has her own business on the side, providing home care to those who struggle to get out and about. Excellent. So there's a lot of entrepreneurs here. There are a lot of people that own their own businesses, a lot of people who are looking to combine possibly their own efforts with employment as well. And that seems to be a growing trend with KINS. I'm going to introduce Matt, who is with us from Sun Life Financial. Matt is the strategy and growth manager at Lumino Health, which is the promotional platform for registered healthcare providers across Canada. His work day to day is developing strategic initiatives to help grow and develop this platform. And it's a brand new platform, as France mentioned, for kinesiologists. It's a new search tool that KINS have just been able to access for the past week and a half or so, from about April the 1st. Matt's background is in sales development, and he previously worked in 2 startups over his 14-year career in fleet software space. He has a degree from Laurier. He majored in business administration. And in his spare time, he's the father of 2, enjoys coaching his kids' sports teams and taking them out to games any chance he gets when it's finally safe to do so. So welcome, Matt. Thanks so much for joining us this evening.
Thank you for having me.
You mentioned you had a bit of a presentation for us. You can take this in any order you wish. It is completely over to you. Oops. There, you're back. You paused, but
All
you're back. Yes.
right. Yeah, I mean, I can pull up some slides, give everybody a feel for the platform, and oftentimes we'll have questions about where things are going, but the less this can be me as a talking head and we get some questions and some interaction, I think the better it is probably for everybody. But I can give us kind of that background, something to look at to get things started for sure.
Sure. Just before you kick off, I realized I forgot to allow Mark to say hello. Mark, I'm sorry about that. He's saying, don't worry about it. Carry on. It's all good. All right. All right. So it's all okay. All right. We'll hear from Mark after Matt's presentation. So Matt, over to you.
Sure thing. All right. Let's kick off from here. This goes. There we go. Everybody see my screen?
Yeah, we're good.
So I guess just level set here, what is Lumino Health and sort of what do we do here? It's innovation by Sun Life, and maybe a bit of backstory on this. The way it came about is we started getting calls from our benefits users asking us to recommend a dentist or recommend a chiropractor that they could go see, and our team at the call support center, it's like, we don't really do that, can't really direct you in the right spot. But as we got more and more calls in, we kind of looked at it and said, okay, we know there's people looking for this, and we've got a wealth of information and data and behind us from the 150 years Sun Life's been around. What if we made our own directory to help people navigate the healthcare landscape out there? Kind of the idea of how do we become the Expedia for healthcare in Canada, that kind of two-sided network where we can connect Canadians looking for healthcare and providers looking for patients and bring them together in one spot, and kind of get away from the idea that if you're looking for healthcare services, you really got Google and find a dentist near me, and you'll find a chiropractor near me. This allows you for, and I'll give you a feel for what that looks like and how we're trying to make it better and evolve it further. But the network itself, I've had over 10 million searches on it so far since its inception. It's got over 150,000 healthcare professionals. We added another, I think, 15,000 or so, including kinesiologists, which we launched about 2 weeks ago now. And perhaps most importantly, we've helped Canadians connect with healthcare providers over 700,000 times. And a lot of times we get asked, why is an insurance company doing something like this? And I think for us, we've always had as the core tenets for Sun Life. You hear Angela talk about it earlier, Sun Life Financial. There's always that financial tie to what Sun Life is doing. And you can see on the right there, our mission statement, if you will, is always about helping clients achieve a lifetime of financial security. But fairly recently, we added in and live healthier lives. And if you think of it, Sun Life's part of the health ecosystem as a payer on our side. And if we can help Canadians get back to work as part of that ecosystem, we can help them stay in their jobs, stay working day to day. We're benefiting by helping drive down short-term and long-term disabilities. We're helping providers by helping them bring patients. We're helping Canadians stay healthy by maintaining their health on a day-to-day basis. And we're helping employers by making sure that everybody's happy and productive at work. So that's where we see ourselves sort of fitting in that health ecosystem right now. And if you take a look at what that looks like, there's really two ways to get there. One, we've got our main site here, which is luminohealth.ca. And then if you're a Sun Life Benefits user, you've got it directly in your app. So where you're processing claims or you're checking your benefits, or your financial statements, whatever it may be. What you're seeing here is right in the app. And is, like I said, think of Expedia, as simple as it sounds. What we're allowing you to do is drop your location in, pick your specialty, and you're off and running. Ryan, I wonder if you're going to show up in here. I don't know if you will or not, but we can see Angela here right up top. There she is, virtual visits available. So it's going to pull in everybody that we've got in our system. So what does that consist of? It consists of anybody that's processed claims with us in the past. We limit it to the past 3 months, allows us to make sure that these folks are still accepting claims, they're still open, they're still in business, they're still doing what they're doing, as we have it tied to based on the specialty that you picked. And then we've got 2 types of profiles. So we've got, a basic profile where we show everybody. And then we've got a custom profile that allows you to customize it, filters you to the top of the list, just kind of like Google Ads would, and allows you to customize with pictures and custom content within your profile. Can you guys hear my son upstairs? Do you hear that? Yeah, no?
Yeah, but it's all good.
Oh, geez. Yeah.
It's not disruptive at all. Don't worry about it.
The Leafs just went down 2-0. He's not happy. So I'll stop there, and I've got a slide that kind of take us through kind of where we think we're going, but just as a quick high-level view, questions, comments.
Did you just say that it's the people that have already put through claims with you that are listed?
Yes, correct.
So is that the challenge where if there's not many people with kinesiology benefits, we wouldn't be able to put claims through with you and therefore wouldn't be able to be on there until we have people who have claims or have benefits?
Potentially. I mean, we're like, you can see here, like it's not a small list. There are a ton that do show up. And I guess I am in Mississauga here. It's probably the more populated area, to be fair. But what we can do is you can show up if you get a custom profile. So in some cases it will, some cases it won't show up. And this is one of the points that, France brought up too, when we were discussing this, is how do we get everybody involved on the platform to begin with some level of representation. And it's not just kinesiologists, we find it with athletic therapists as well. We find it with, other specialists that aren't covered in what I'll call, the core benefit packages that Sun Life puts out there. But there certainly are packages that we have with our corporate sponsors that do include kinesiology. Sorry, Deanna, you're on mute.
Just not many in Huntsville.
Well, it's funny. We talked about the athletic therapists in BC and what they started doing. Yes, they are talking to Sun Life and insurance companies to push for that, but they started going at the corporate sponsors and going to the large businesses there to say, here's why you should have athletic therapy as part of your benefits package, to then put pressure on Sun Life, say, hey, I want this added in, because we certainly have that flexibility to have it added in, but it comes down to the corporate sponsors a lot of times at the end of the day. But I think this, is part of that. You've talked to, France and Angela a lot about how do we then start educating folks on this and better understanding where you go for certain treatment and why you would go see a kinesiologist or any of those other specialties that are out there. And we're starting to talk about, building out that content, because one of the other key pieces for us for Lumino Health is our health topics and health guides, which drive a lot of the traffic to the website and go a long way towards, helping build out that level of education. Because we want this to be more than just a directory. We want this to be that kind of central hub for healthcare for Canadians.
I think that's one of the biggest areas where KINs are struggling at the moment is educating employers about why kinesiology needs to be added into that pick list. And so looking for some very consistent messaging that all kinesiologists can provide to their own clients, who then can go to the employer and say, here's why we need KINs added into our sponsor packages or our insurer packages when those packages are renegotiated for the next time through. So I think that's a huge area where educating the employers could be something that KINs could be extremely powerful with, because then, Matt, we could come to you, or the employers would come to you to say, I'd like to add kinesiology into my package. Would that be something that Sun Life is able to do, is to alter some of those existing packages to add kinesiology in?
Yeah, I mean, it's, again, I just want to be clear, it's not my area as part of Luminal. I know that's not what you want to hear. But certainly, yeah, like we're changing those and altering those packages all the time on, it's our group benefits team that's doing a lot of that effort. But like I said, we've certainly have corporate sponsors that have this as part of their packages. And like you said, some that don't, but that comes down to them at the end of the day.
Mm-hmm. I think one of the things that we were talking about, Matt, was talking to insurance companies to say, kinesiologists are well positioned to help with rehabilitation, with prevention, with making sure that your insureds don't make claims in the first place, so that KINs can actually help insurers save money. And so by offering KINs as part of that pick list, your insureds are going to be using our services and not access their benefits plans for anything more than their allotted number of KIN treatment sessions during the year. So switching the script a little bit, saying KINs are preeminently going to be these preventative healthcare specialists, rather than the people that you go to see following acute injury. And that may be a way of saying to employers, we'll keep your employees at work. We will lower your sick days. We will lower your disability claims costs, but you got to add us to the package so that you can see what we can do to help to keep those numbers and essentially those dollars in check and in your pockets, so that you're not paying out a lot of money in claims, and everyone is going to be benefiting from that, certainly.
Totally. Yeah. I totally get what you're saying. And, we run up against it all the time too. Sun Life's kind of the big behemoth behind Lumino too.
Mhm.
And, they're supporting this now, full force in terms of national ad campaign out there behind Lumino. So yeah, we're looking for this level of feedback, and I have no issue bringing this back to our team internally here to let them know what we're hearing. That's part of the reason I'm here, is to hear that that type of feedback.
Is question, if you make, for the Lumino, if you make claims as like through a physio clinic, it doesn't necessarily have to be a claim to kinesiology, but through physio, does that allow you on there as well? Like,
But you can get on it no matter
as a kinesiologist,
what,
but through a physio claim
with a custom profile. So you can get on sort of with the subscription no matter what. That's our one avenue right now. That is another issue that we have in terms of getting these folks on here, because if the claim goes in, let's say under the physiotherapist, even though they're with the patient, that's going to show as the physiotherapist.
Okay.
We have the same issues with dental hygienists have the same type of feedback. The hygienist does the work, the claim gets submitted under the dentist. So we're looking at avenues now to how we can better represent these specialties in order to fully reflect what's out there. So we're not there yet, but as we develop it out and build it out, hopefully we're striving to get to a point where we can fully represent it, Deanna, to have
Awesome.
it all covered up.
And you may not be able to answer this, but is it, when employers get a pick list of options for their benefit packages, is kin on there? Like, do they even know that it's an option to choose when they get a list, or is it,
I'd be honest, I'm
something
not
that-
sure what
okay.
they
Just thought
see
I'd
on
ask.
their side, but I would think that we're putting forward everything possible. We'd like them to check every single box, I'm sure, on the group benefits side, but again, I'm not positive there.
Okay, no worries, thanks.
No problem.
Talk to me about the rating system. How does that work, and why do we feel it's important as regulated healthcare professionals to have a patient that puts forth a claim, and then after they put in the claim, they are prompted to rate their therapist?
Yeah, it's a good question. I mean, you can see here, we don't have them yet for KINs, but yes, it is in other spots. If you just go to Cairo here, you'll have two things attached there. You'll have a star rating, and you'll have a cost category, depending on the specialty, depending on how much it costs per visit. And I think they're important for a couple of reasons. One, we know these rating systems are everywhere. You go to Rate My MD, you can go to Google, you'll have these rating systems kind of across the board. I think what makes this unique is I know for sure who's putting in that rating, and that person that's putting in that rating definitely went to go see that individual when they went to see them. Whereas if you're on Google or Rate My MD, that could be anybody. Anybody can make up an account and drop a rating in on any provider that they want across the board. Knowing that this person came to see you, had your treatment, I think that's what makes this different. And I think if I'm not on this side of the house, I work with the providers, but we've got folks that work on the consumer side, and they view the ratings and the cost categories almost as table stakes when it comes to these level of directories. Consumers are looking for these types of things when they have this available in front of them. So we wanted to make sure we put it in ours.
So the idea here is that I can purchase the control of my profile, correct? And through that purchase, this is the way I understand it. Maybe I'm completely wrong because I don't know anything. And through that purchase of that, that's when people can leave reviews for me as well.
All right, it's a great question. Okay, I'm glad you asked.
Because the only reason why I asked this, because I'm also a registered massage therapist, and so massage therapy has this a lot. And there's always talk amongst massage therapists how this system fares against the Massage Therapy Act and fares against the RHPA, more specifically the Massage Therapy Act and Kinesiology Act with reference to testimonials. So if I take in an account, in other words, I'm opening up the floodgates for people to leave reviews and leave a star rating and a review, then there's a very gray area here under the legislation.
Okay, so I'll explain sort of my perspective. I'm not familiar with that specific legislation. I am on the dental side where it's extremely strict too in terms of marketing or whatnot. But we're collecting those ratings and displaying them, whether you quote unquote open up your profile or you don't. So if I go down to some of these baseline programs, we're still showing a star rating and still showing the cost categories. So it's whether or not you have that quote unquote control over your subscription or not. We're still displaying that. I'll give you sort of my perspective from the dental end of things, because there's a lot of restrictions on what you can say from a marketing standpoint. If you're a dentist, I can't say this is top of the line technology or I am a 5-star rated dentist, but that's on their websites. If this is on our website, it's a little bit different in terms of how they manage that for their star ratings. And they're coming from, again, from their patients individually. I don't know if that answers your question, but feel free to square it up if I missed it.
I was just wondering if it's a consideration to the super gray area that this really dives into when it comes to the rating and it comes to the testimonial pieces that the platform allows for.
We don't include any testimonials. It's purely just the rating, and the rating's based on one question. Essentially, how did you feel about your experience with this provider? And it gives you the option to rate them 1 to 5 stars. So no commentary or anything like that's tied to it.
So are they all anonymous then? There's no name attached to the rating? So it's not
Correct.
like Joe Blow rated you 5 stars.
Correct.
Okay.
Yeah, so I think that's how they get around it, is that it's anonymized. Yeah, because that can be tricky. That's something that as KINs we're not able to do, is to have our clients commenting about our services anywhere.
How do you get around Google reviews and stuff like that? That's, a little bit more open.
It's a challenge because, like this platform, we are not able to control who says what about our practice. So on our own materials, we're not permitted to solicit testimonials, post testimonials, anything like that. Google platforms like this, the understanding is we're not soliciting people to leave these reviews. So they are doing it of their own volition, as you said, and it's a 1 to 5 star ranking system. So it's a little more gray.
Yeah, and then the other piece for Google, I mean, at the end of the day, you can decide whether you have a Google My Business account, which allows that to happen. So you're
Right.
making that choice. But provided I have someone that is with Sun Life and they put a claim through from seeing me, then, this is beyond my choice at this point.
Mm-hmm. Yeah, that's very true. They can make a claim. They can send in your receipt or not. So it removes you just that one more level from being responsible for their feedback. Yeah, it's gray.
Cool, thanks.
Yeah. France had a question, and I know this pertained to Deanna's comments. France, isn't it forbidden to do this under our CKO rules or laws or guidance? I think you were referring to Deanna working with a physiotherapist on a client claim.
Exactly, claiming kin services under physiotherapist.
So it wouldn't be illegal because in this situation, Deanna would be a treatment provider on the treatment plan, which would be supervised by the physiotherapist. So Deanna is just one of the treatment providers working on that plan. So there could also be a massage therapist. There could be another kin doing return to work tasks with the file. It's just the physiotherapist is actually coordinating the treatment plan, for lack of a better word. So no, it's not forbidden for a kin to be part of that treatment plan. What would be forbidden is for the physiotherapist to come to say that Deanna was performing physiotherapy tasks, non-delegated. So that she would be giving Deanna the ability to work as a physio might with tasks that she didn't delegate or supervise.
But then wouldn't that be that who's claiming what? The physio is claiming for
Physio.
the physio,
The physio is claiming physio,
which includes kin service.
which includes exercise service provided by a kin.
As far as I understand it to be, as long as the physio is rostered through their college to have assistance, then they can delegate tasks, and that would.
Okay, my first understanding of Diana a comment was that her as a kin was using a physio to put in claims or to be.
Yeah,
which
no.
is no, I misunderstood what she said. All right.
Yeah, no problem.
But
I just know there's a kinesiologist that's also a physiotherapist. So I didn't know how they put through their claims. If they would most likely put all of them through physio because so few people in this area are covered by
Mhm.
for kinesiology. So
Mhm.
I'm just wondering if she gets on the roster as a kin because she's also a physio and has put through claims as a physio.
Yeah, but that doesn't help us, the profession, to be more and more on those
Mhm.
list of claims that are reimbursed if we always go through and have the physio do it on our
No,
app.
it's
It
not.
doesn't help.
It doesn't help, but it's the only way to get paid sometimes.
Yeah, it's just
The only way to get a
unfortunately,
job.
yeah, it's just unfortunately our reality, because if a
Yeah.
physio needs a kinesiologist to do the exercise therapy, they are going to be listing the kin as working on that file, but it's their file. So it's just unfortunately the reality of getting the client the services that they need. And they're delegating to the kinesiologist the ability to carry out the exercise rehabilitation portion of that treatment plan.
I understand, but
Yeah.
you need to see that in order for all this to change, it requires us as kins to stand up and say, and yeah, being paid by the physio is fine, but if for the moment it is how it's done, but it doesn't prevent us or stops us from sending out the letter, having clients send out the letters to their
Mhm.
employers and to their insurance company asking for kinesiology to be added, because it comes at the end of the day, it comes, the client has the power to change things. We do lobby, we do a lot of things, but HR person won't change the package unless they're asked by the client. But I understand
And
your case. Okay.
And the other challenge will be that a lot of my clients are seniors. So their packages are either retirement packages, so no longer working with their employers, or they're their husbands or right, packages from someone as a spouse. And the husband and the spouse may not even be. So those packages are much harder to influence than, say, the younger clients who are still working and still have an employer to start, asking and promoting kinesiology. So we're getting there, and it'll get there, and it's on. I will keep trying. Just for right now, it's just a little more challenging.
Yeah, it's definitely more challenging. And Carrie, I saw you nodding your head there. A lot of our clients are over 75, and a lot of the packages are expiring at age 75. So they're either being commuted to a different kind of retirement extended healthcare benefits package, or they're being canceled. So it's tricky, and then that's something that kins are really struggling with, because a lot of our clients are well north of 75 for the most part. Yeah.
It actually happened today with one of my clients who's in a retirement home. I don't know how old she is off the top of my head, but her plan is from her husband who has passed, but he worked for the university in town here, I think University of Waterloo. And she asked me again today about, has there anything changed with kinesiology? Does insurance now cover kinesiology? And I said, like, you have to talk to the insurance company or talk to the university. And she said that she's called the university before and they have just given her the phone number of the insurance company.
Ugh.
So I don't know if it feels like it's, for me on my end, it kind of feels like everyone's just bouncing the ball into another court.
Yeah. So Matt, you can see that it's a big area of frustration, not only for us as kins, but also for our clients, and then also for the employers. We need to educate the employers about the need for kinesiology, so that they are not passing the buck when an employee calls them to say, can we add kinesiology? They're like, I have no idea what this word even is. So how do I even add them in? And then, to your point, France, as kinesiologists, we need to put pressure on the employers, particularly the universities. You've got a degree from Laurier, Waterloo, name the list, everybody. If you are teaching kinesiologists, please make sure that kinesiologist exists on your plan so that everyone who works with the university can access our services. So pointing out that kind of logic, I think, makes sense. Renegotiating the plans every 3 years, every 5 years is their eligibility. It probably depends on the employer.
Yeah, typically though.
Yeah. So I think that's the biggest hurdle. I was checking out my mate's plan going, wait a minute, there's no kinesiologist on here. I know his boss really well. He's a good friend. And he's like, Ange, before I met you, I didn't know about kinesiology. And he said, frankly, we needed an extended health benefit. They're a 2-year-old startup. They needed an extended healthcare benefits plan. He goes, I phoned Manulife and I said, we need a extended healthcare benefits plan. They were like, okay, you can have package A, B, or C. He's like, A? And they were like, great, sign here. So a lot of it is reaching out to the employers to say, here's why you need to take the package that has kinesiology in it, and then working with the insurers to make sure that kin is part of that list. So I think there's so many areas here, France, to your point, where kins can be hugely influential in trying to get these things put into place.
Right, especially Manulife is one company for which I have a lot of claim managers calling me to verify if kins are in good standing and so on. So I could tell you that Manulife do reimburse kinesiology so services. So it all comes back to which package they have and so forth, and it's the clients really that manage that. There was I don't know if you had it, if you knew, but there was if you're a member of OK, there was another presentation about insurance presented by CLIA, which is the Canadian Insurance Association for fraud and etc. And they covered the structure in an insurance company and how claims or how professionals are selected and so on. If you are a member of OKA, that presentation is available on their website. I encourage you to go and visit. It's just another point of information.
Mm-hmm. No, that's great. Thank you for that.
Can I ask you a question, sorry, really quick, about delisting providers? And how does that work? And how does a provider end up being delisted?
Yeah, it's a bit of a loaded question. Usually it doesn't happen in our group.
Okay.
We don't like it if they get to listings, then they come off of our directory. But it can happen for a variety of reasons. There's, suspected of fraud. There is an issue with them that we come across. I know there's a group here on our side that does a ton of tracking if there is an issue with them from a code of conduct standpoint, if they're not in good standing within their regulated body, whatever that may be. So there's a number of reasons they can get delisted and not be able to submit claims anymore.
Okay.
Mm-hmm. Any other questions for Matt?
Would you be able to just go through like what information is in the listing and the ones that are auto generated, and then also the I'm not sure what you call them, like the sponsored listings?
Sure. Yeah, totally. So our basic listings just have a couple of things. They'll have your name, address, and phone number. So a call button to interact with. And then our custom listings will have much more detail. So most notably, you'll get priority placement, kind of think like Google Ads. You get placed at the top of search depending on where the individual is searching from. Your ability to customize, so pictures, details in the profile, which I'll show you in a sec. And then you get a point of interaction here. So in some cases, providers will just want to request an appointment, which will be as simple as offering up date and time, comments why you want to come by, and then details of the individual. Others will have a direct booking. So in this case, this provider uses our practice management platform. We work with a company called Go Rendezvous. So that builds it right into the experience here, where I can pick a time at either one of Dr. Mike here's locations in Streetsville or Port Credit. He doesn't have any times available right now. And then others will have a book now. Let's see if I can find one that'll link directly out into their booking platform. So in this case, this provider's got a practice management platform called JNAP that they utilize, and we'll link directly into their booking platform to allow patients to book that way. And then the last thing here we'll have is, I don't know if you saw it here, we're building this out right now. We're not quite there with it yet, but you'll see this instant booking component up here. And what we've done is in the systems that we've built directly in through our Go Rendezvous platform, we've got another option available for those that don't use Go Rendezvous, but right now we're just starting with that. What we've done is we've got the ability to post your availabilities. So that allows providers to, one, get in their short-term availabilities, and then allows Canadians to access what they're looking for, perhaps a little quicker if they need something a little bit more immediate. So I can see Kaleem here. His next available appointment is on Wednesday, so I can book with him directly through here. And then I said I was going to get into the profile. And then in the individual profile, everything you kind of expect within a baseline profile. You got your hours of availability, which is searchable, quick description, treatments and services, languages, which is another key filter for our providers, education, professional associations, and then pictures of the facility.
So France, when you were working with Matt, were you able to have KINs across Canada listed, or was there a criteria that you went through for certain kinds of listings?
Right. If you've read the e-newsletter that went out on March 26th, the CKA announced a three new network that we made available to all affiliated KINs. So we have three different networks: the IMC one, another one called Health Locator, and Lumino Health, because they all cater to different kind of entry level, if you want, or they're different doors. So yeah, it's available to all affiliated KINs. Of course, in the case of the Lumino, and maybe Matthew can talk about this, there's different packages. So of course, depending on which package you take, there's different costs. There are some of the other platforms are also free, or depends on which package you take. So maybe Matthew, you could run that by people. What are the packages available and so forth?
Yeah, right now, as we move towards the booking platform, we really have just got the one baseline one. Like I was saying before, we've got a practice management software, we've got a virtual care software, but right now we're focused on the one platform or the one profile. This profile, from a subscription standpoint, is $89 per month per provider, and then through the CKA, we've got a discount for members that'll offer them 50% off for the first 6 months.
But you have to sign before which date?
April 30th. France is looking to get it extended.
You're reading my mind. You're reading my mind.
6 months or the April 30th? Yeah.
April 30th, I want to extend. One day at a time.
So as you look at a platform like this, everybody, does this look like something of interest to you? Do you think that you would be able to reach your client base more easily, more readily by putting yourself out there across Canada to not only Sun Life insureds now, this is a publicly available platform, right, Matt? I think this is not just now available for Sun Life insureds, or is it restricted a bit?
No, it's both. And before, like when we launched the platform, probably not surprisingly, like 95% of the folks that were using it were Sun Life users, obviously.
Sure.
But we've really done a ton of work to drive SEO to the website. And now 60% of our traffic comes from the website, which I guess, at the end of the day could still be Sun Life users, but for the most part, they're accessing it through our secured app and whatnot through their login. So we're getting a ton of traffic from, like you said, Manulife, Green Shield. You can have any type of benefits to utilize this.
Mm-hmm. And in terms of competition for you, there's not a lot, particularly I don't see a lot in terms of having the robust back end of the different health guides that you have and the other features that you're hoping to provide. Is that right?
Yeah, I mean, there's certainly there's a lot of insurers out there that have their own kind of preferred network, where they say you go to one of these 10 providers and that's who we use across the board. We're not trying to build it out that way. We prefer it not to be that way. We're not building this to be a preferred network. We're showing everybody and want everybody to be searchable and available on the platform. But yeah, not much else out there that has this level of breadth and reach.
Mm-hmm. Mm-hmm.
Yeah, and you can't really have it as a preferred provider type of thing. Like that just takes away patient autonomy. You can't do that.
Yeah, it's a challenge. Becomes a little bit of a human rights issue when we can't access the providers, Yeah,
it's worse than when it's healthcare, right? Like
it's also, national healthcare. That's right.
Matt, what about from I'm thinking about it from a clinical perspective or my clinic perspective. We have referrals to the clinic, not to our practitioners themselves. So how would it work in that context?
What do you mean by that?
So when people want to use our services, they're booking the clinic services, not the kinesiologists themselves.
Gotcha. Yeah, it's a great question. We do get it a lot in terms of, especially rehab clinics where you've got a wide number of services that you have to offer. We're exploring the option of getting, call it facility-based profiles that'll be a little bit more broader. You'll be able to search for multiple things at once. We're just not there yet. Like the directory built with the back end of Sun Life claims coming through, that was all provider driven. Your experience when you go see somebody is with the individual provider as opposed to as much as it is with the facility. But definitely something we're looking at sort of down the line. How can we get that broader based experience for individuals, as they're looking for potentially multiple services across the spectrum.
And then my other question would be, I know you have that 50% discount, but would there ever be an opportunity where you would have, say, like a 30-day free trial for the premium option, just to see if it's worthwhile to the practitioners to use it or not?
We used to have it from when we initially kicked off. I get it, kins weren't on there at that point, but we don't have the trials anymore. We do offer it, you know, I did say 6 months, but it's a month-to-month plan at that point. So, you know, with marketing, obviously we want to take kind of that longer term view of it. We do, especially, you know, in these days where, you know, things are a little bit more, you know, precarious when it comes to costs, offer the flexibility to, you know, change your plan as you go through that 6-month time cycle.
Yeah, that was one of my questions as well, Ryan, was what kind of uptake has there been by people utilizing the platform? And I think that a big part of what Lumino can help us with is actually talking about kinesiology and in terms of, by way of doing that is also talking about all healthcare professions. So teaching Sun Life insureds, but also members of the public about all of the different healthcare professions, how to choose the one that you start with, and how do you make up your mind about which one to start with. So I think there's a huge education opportunity here where they can provide a lot of value-added service to say, here's the professional that I am choosing and here's why. So it's an informed decision on my part. I understand what I'm purchasing. And of course, we know as kins that if the person that we get on the other end of the assessment session is not going to be someone we'll work with, we certainly will be referring, so that the person choosing us doesn't have to worry that we would continue working with them if they weren't the right fit for us. So that's another piece, is actually teaching everyone what kins are all about in order for them to be even interested in working with us as well. So I have a question here, a comment here. People who are looking for kin services tend to know what kins are, as I mentioned, rather than picking them randomly out of a list of professions. So people are able to Google kin plus Toronto plus Thunder Bay plus Huntsville rather than going through this platform. So people who are coming to the platform, there may be a thought that their extended health benefits plan would cover kinesiology services if they found their kinesiologist listed on your platform. So how might we be able to talk about whether kins are all covered by Sun Life plans, or you're leaving it up, I guess, to the consumer to say, well, I'm a Sun Life insured, but I just realized that I'm not covered. My kinesiology sessions aren't covered by Sun Life because my employer doesn't have the right package, so to speak. So that's a risk for that directory, I believe.
Yeah, I mean, I think from the public side of it, you know, we could come across that across any specialty. I could be looking for a dentist and be out of my dental credits, you know, from a benefit standpoint. So I don't think anything changes from that perspective. But in app, if you're in app and you're logged into your Sun Life app with kinesiology, with athletic therapists, with clinical counselors, with psychotherapists, all kind of in that same boat, what we're doing, and the feedback that we got anyways was, let's make sure that you're not sending folks to us that might have that level of confusion and think that this is going to be covered and then get bumped back and have to pay out of pocket. And that's a bad experience for the individual. It's a bad experience for the individual provider, who then has to turn away a client, and nobody wins that way. So what we've done is, in those circumstances where that is the case, when you search kinesiologist in the app, there's gonna be a pop-up say, hey, double check your benefits, make sure that you're good there before searching, or just understand that this is, you should do your due diligence ahead of going into this.
Yeah, that would be appreciated. I mean, that's something that we face all the time, because after people are asking for our rates, or maybe just before they ask us about our rates, is how do I know if this is covered by my extended health benefits plan? And we say, you have to call your employer, you have to look up your policy booklet, you have to check it out with the insurer directly. So there's a lot of us that have prepared letters saying, here's exactly what you're looking for.
Yeah.
And then here's another letter to say to your employer, please add kinesiologists or athletic therapists, right, to the plan package the next time you renegotiate it. Yeah. So Sandra, I don't know whether I am putting you on the spot here a little bit. You can decide whether to speak up or not. The Ontario Kinesiology Association had a big meeting this evening that conflicted with our call tonight. And they were specifically talking about how KINs are going to better get in front of extended healthcare benefits plans and the insurers providing those plans. This is putting you on the spot, I realize, but do you want to comment at all about any news for KINs about what the OKA is doing to help us in cases like with Sun Life? No, dead silence. That's okay, totally fine. So we'll find out a little bit more about that committee meeting and find out what our next steps are as KINs. Oh, no problem at all. I was just asking if you had any feedback from the OKA's meeting this evening about plans for KINs and extended healthcare benefits plans. No problem at all. That's just fine. Okay, any other questions for Matt? We know we're challenged by trying to get on the plans. We know Matt is challenged because of that, because he wants to add KINs to his platform. And so we're both struggling with the same issue. We need KINs to be better understood, better recognized, and much more exposed to the public and primarily to employers, so that they're now asking to have KINs included on their negotiated plans that they're purchasing. Matt, I guess you were saying previously that employers are purchasing plans for a certain time period. Are they signing on with Sun Life, for example, for a certain number of years? How does that work?
I'll be honest, I don't know the full details, the extent of what they're doing. I'm sure it varies client by client in terms of the length or term that they sign up for. I'm pretty sure the standard is around 3 years.
Okay.
But again, I think it comes down to the individual corporate sponsor to figure out where they want to put that.
Right, right. All right. Thank you to Mark at Con Ed. He's off to record 2 massage therapists and a microphone, his podcast that they record every week. So is there any questions before we wrap up, Ryan?
Yeah, I got one more. Matt, I know you probably can't answer this, but speaking of employers that are trying to get their benefits changed, Tafasco is looking at this, and they've asked us, what data do you have to support like having paramedical services as part of your benefits plan to reduce costs? So like utilizing services, will it reduce WSIB costs and other costs? Do you guys have any data to support that?
Honestly, I don't know. I don't off the top of my head. But there's a chance our content team might. Lindsay, the folks that you're working with, Angela, they might have some details. So I don't mind reaching out to her and seeing what she has to say and see if she's got anything.
Yeah, Ryan, that's the best thing, is to be able to provide a business case to employers to say, this is why you need to add KINs. Look at how we're able to keep costs down, to lower costs even, and to frankly stop claims from even happening, because we're doing the preventative work. We're adjusting workstations. We're doing those work hardening programs, those pre-employment post-offer screens, the general conditioning programs, the education about nutrition, rest, sleep, and we're keeping people working. And so you can't always see that. That's not always a tangible return because we're only able to measure the claims costs. And so that's one of the reasons why it's so tricky to have KINs involved with a robust case behind us, is because if we're doing our jobs well, claims rates will go down, and or they just won't get to the heights that maybe they had been in the past. So a little bit in the background, but that should be measurable in terms of bringing kins into a workplace, measuring pre-post kin intervention, and looking at it from that standpoint. So it might be, a 3 to 6 year study of, okay, we don't have kin services available. Now we have kin services available. Over this 6 year period, what happened to our claims cost? And that might be something that we would look for assistance from an insurer to put into place. Well, thanks everybody. We blew past 9 p.m. or 8 p.m. as we usually do. Does anyone have any other questions for Matt? And if you have questions and they're not quite formulated yet, send them over to me and I can toss them over to Matt, and we'll get back to you for sure.
Thank you. Thanks for your time, Matt.
Yeah, thanks, Matt. This has been a
you.
really good discussion, and we will make sure to reach out to you with any further questions. And I know you and I will be in touch in the future.
Awesome.
Thanks
a lot,
everyone.
everyone.
Have a good evening.
Take care. Bye now.
Bye for now.